It's Wendy Bowen, physiotherapist with Know Your Body Better. So I had a question about the frozen shoulder. You may have heard of it. We refer to it as adhesive capsulitis. So we're going to talk a little bit about shoulder anatomy. So you've got your shoulder blade, your collarbone, your humerus. Okay, so the humerus has a big head on it. The shoulder blade has a very small socket, so that ball fits into the socket. So around that, to help hold that in place, we have what's called a capsule. A capsule is just, again, I refer to the capsule as duct tape. It's just really tough collagen tissue, and that fits over top of the humerus like this, and it helps hold that ball in the socket. Well, that has to be loose enough so when you raise your arm, that ball will move in the socket. But it also has to be tight enough so it doesn't come out of joint. With a frozen shoulder, that capsule has become too tight and it won't let that ball spin in the socket. So it gets very jammed. So what you'll see is then you're trying to raise your arm and the whole thing has to raise. So you see people doing this as they try to raise their arm, they hike it up. Usually you've lost range of motion in rolling your arm out, lifting your arm up to the side, and especially reaching behind the back. It's usually stuck this way. So it's stuck in multiple directions, not just one. So we honestly don't know why it happens 100%. Sometimes it can be a virus. I've seen it happen in people immediately post-injury and they can't move it afterwards. It's not the fact that they hadn't moved their shoulder. And it does take, it's kind of that freezing, frozen, and then thawing stages. So in the freezing, there's a lot of pain, so typically you're not going to do a lot of movement. And that's where working with your physicians, having some injections can be quite helpful. But when you get, one exercise that people do tend to find they can do though is this pendular exercise. So they're hanging their arm, you can use a weight and hang your arm, and you just swing your arm in circles and in figure eights, and this usually helps distract. So pull down the ball a little bit looser from the socket and get some movement to loosen. Other exercises can be quite painful during the freezing stage. During the thawing stage, you want to do some of your shoulder stretches that I've shown you in the past. So you do want to try to reach behind your back. Sometimes you need a towel to get this back. Pain is your guide, but a lot of times, so you're not letting that shoulder round forward, you're trying to keep your hand on the buttock and then slide it up the back here. And in the frozen stage and the thawing stages, you can tend to take it to the edge of pain. In the freezing stage, where it's usually quite painful, that's usually where you're going to stop before you get to the edge of pain. So we want to get the range back in the frozen and the thawing stages. So that's when you're going to do more external rotation exercises. Sometimes you need to use a stick and push it side to side. So you're getting a little passive motion. So I'm using this hand to push this hand. So you do have to get the range of motion back. So you're going to do your pendular during the initial stages when it's really quite painful. And then you're going to do some of the shoulder stretches that I've shown you in the past. So hand behind the back, the towel drying, working on that external rotation. Another one is where you can take your hand, put it on the wall, and walk your fingers up the wall. I'm not going to move over there and show you this, but you just, and use your other hand to help you walk the fingers up the wall. And the other one that I really like is the child's pose. And you might only get this far before you feel that pinch in the stuck. But you're thinking of, as you're doing your shoulder exercises, think about the ball spinning in that socket. Okay, that ball has to spin and drop down. When you raise your arm, the ball has to drop down a little bit. So those are a few exercises that can help you with frozen shoulder. But remember, if you're having a lot of pain and the exercises are aggravating that pain, you need to see your healthcare professional to get some further guidance. So it's Wendy Bowen, physiotherapist with Know Your Body Better.